Hi everyone, my name is Kelsi Batioja and I'm a third year medical student at OSU Com at the Cherokee Nation. And today I'm going to be presenting on the topic of childhood obesity. Our project is entitled The Associations of Social Determinants of Health and Childhood Obesity, a cross-sectional analysis of the 2021 National Survey of Children's Health. Childhood obesity is a growing health problem. So according to the CDC, approximately 14.7 million children were affected by childhood obesity from 2017 to 2020. 32.3% of children in Oklahoma are classified as being overweight or having obesity, which is comparable to the national average at 32.1%. Additionally, children who experience being overweight or having obesity are more likely to maintain obesity into adulthood, but they also have an increased risk of developing chronic diseases at a younger age. Social determinants of health may influence overall health and play a prominent role in childhood obesity. Social determinants were first posited by Michael Marmot and contain 5 different pillars, including economic stability, education access and quality, healthcare access and quality, social and community context, and neighborhood or built environment in which one lives. Socioeconomic status is a component of the economic stability domain, and studies have shown that children of low socioeconomic status are more likely to experience being overweight and having poor health outcomes. Further, families of low socioeconomic status have shown to be more likely to experience food insecurity, and studies have demonstrated children in food insecure households were more likely to experience childhood obesity. Childhood obesity can have profound effects on overall health, so identifying potential associations between the social determinants of health may inform recommendations to address this growing health concern. So with that being said, our objective was to use the National Survey of Children's Health 2021 data to determine current associations between childhood obesity and social determinants of health. So we used the NSCH 2021 NSCH survey to extract data from questions relating to the social determinants of health domain. These surveys were collected via mail or online by the primary caregiver for children aged 0 to 17. So these questions were: during the past 12 months, did this child receive any kind of medical care? During the past 12 months, was there a time when this child needed health care but it was not received? Since this child was born, has it frequently been hard to cover basics on your family's income? Has your household had difficulty with being able to afford food in the last 12 months? And to what extent do you agree with the statement? This child is safe in our neighborhood, and this child is safe at school. Any parent or guardian who answered the variable BMI class in children aged 10 to 17 was used. We included this age range because the NSCH only collected data on these children, which is in accordance with the Title V Maternal and Child Health National Outcome Measure. We extracted socio-demographic variables of age, sex, race, ethnicity, household income based on the federal poverty level, education level of the adult in the household, and we used them as controls. We then constructed bivariate and multivariable regression models to determine associations of the social determinants of health and childhood obesity via odds ratios. We found that children identified as having obesity were more likely to experience social determinants of health in all domains. However, after controlling for all socio-demographic variables, food insecurity was the only social determinant domain to remain statistically significant, with children having obesity being 1.39 times more likely to experience food insecurity compared to non-obese children. So early experience with food insecurity may be a driver of childhood obesity and associated with poor health outcomes. Addressing barriers to food insecurity and increasing access to supplemental food programs is a critical step. One way we could do this is through policy improvement. So programs such as SNAP have shown to reduce the likelihood of families experiencing food insecurity, as well as children with early childhood access to these benefits were shown to have a lower risk of obesity, heart disease, and diabetes. So the state, for example, the State of Childhood Obesity, an initiative by the Robert Wood Johnson Family Foundation, have provided 5 policy recommendations related to SNAP. Additionally, food pantries and food banks can also play a significant role in providing supplemental nutrition to low-income families not qualifying for government assistance. So for instance, ensuring USDA-funded programs such as TFAP, which is the Emergency Food Assistance Program, and nonprofit agencies such as Feeding America may help alleviate food insecurity and food insufficiency in affected households with children. In conclusion, childhood obesity is an ongoing public health concern in the US. Our study found that the food insecurity domain of social determinants of health was significantly associated with childhood obesity. Given the poor health outcomes associated with childhood obesity, improving policies for programs such as SNAP and addressing lack of access to nutritious foods may help alleviate some food insecurity. Improving access to adequate amounts of nutritious foods for children and their families is critical. And using these approaches may help address childhood obesity, thus decreasing the risk of developing chronic diseases and having poor long term health outcomes. These are just some references, and here's contact information if anybody needs it. Thank you.